closer to what we describe as population level immunity that will allow us to come out of this COVID-19 pandemic. Next. 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 Very good. So the pillar 1 is procurement of vaccine. Pillar 2 is to support the deployment of this COVID-19 vaccine. Let me say here that this program is going to support all vaccines irrespective of the source of the vaccine, either COVAX, Harvard, through the SLL program, or even through bilateral donations. So whichever vaccine that is available in any of our member states will be supported by this program as far as getting the shot into people's arms. Then, of course, the number 3 there is one of those key commodities to guarantee our air security, local manufacturing capacity. And the last 2 days, our leadership on the continent met here in Kigali to drive the agenda of local manufacturing of vaccines on the continent. So this program will also support that aspect of vaccine. And the focus of this program is on capacity building, human resources for this COVID-19 vaccine manufacturing and other vaccines, as articulated by the Deputy Director. Today, we are on 1%. So what do we need to do to get to 60% by 2040? That is target set by Africa CDC. So this program will support the step that will take us to reaching that particular 40%, 60% by 2040. Then the last bit there is to strengthen Africa CDC capacity. And when we say Africa CDC, this also includes our regional collaborating centers. Our MPHIs will also benefit, because when you look at the staff structure of this program, actually follow the line of the Africa CDC operating model, which is the National Public Health Institute, the regional collaborating centers, and the Africa CDC headquarters itself. Next. So these are the principles underlying this program. Number 1 there is that of inclusivity, meaning that all member states will benefit from this program. Number 2, equity. This will also reflect country circumstances and needs. Accountability is also key to this particular program. This program is going to be member state owned, member state driven, and member state led. So implementing partners are there to support. Africa CDC is there to coordinate and provide necessary enablers for us to effectively and efficiently implement this particular program. Collaboration is key. And at the end of the day, we want to see improved national healthcare system. We want to see resilient health system. So that is the ultimate goal of this particular program. And of course, we know that as far as COVID-19 is concerned, a lot is still unknown, it's still fastly evolving, it's a dynamic field. So as much as possible, for this particular program, we will be sailing as we are building the ship, so nobody knows it all. So the most important thing is that flexibility so that we adjust as we move along. Next. So these are the key activities that will be covered by this program, from procurement to support for in-country logistics, risk communication community engagement, setting up COVID-19 vaccination centers, safety surveillance, that's pharmacovigilance, genomic sequencing, supporting member states to be able to carry out molecular surveillance, technical assistance to member states, data and information system, hiring of a program staff, and some operational research, especially vaccine effectiveness survey, especially changing in behavior towards the uptake of the COVID-19 vaccine, and any other research as identified by member states. Next. So, colleagues, ladies and gentlemen, that's just a brief overview of what the Saving Lives and Livelihood program is all about. So I thank you for your attention. So at this junction, we will be going out to have a group photograph with His Excellency, the Minister of Health of Rwanda. And after that, we'll proceed for our tea break. And we'll come back after tea break to continue the program. Thank you for listening. And yeah, when we come back, we'll take the questions and comments. So thank you. Photograph.
Yes.
So just for today.
Can you help me with these buttons?
Can you handle it alone? You have to hold the board behind. Yeah.